So hey everybody, you're on the injury concepts part of my website, and today we're discussing Per Aspenberg, who's an orthopedic surgeon in Europe, and his work on tendinopathies or tendonitis. So let's talk today a few different concepts. First, let's talk about what a tendon actually is. A fibrous band that connects your muscle to a bone. And that fibrous band is actually quite dense. It's denser than the muscle tissue, but perhaps not as dense as a ligament, which holds bone to bone. But either way, tendonitis is something that many of you are probably being told that you have when you have an injury. And what Per Aspenberg did, which I think is brilliant, is I was looking for the answers to some questions about what I should be doing to patients when they arrive here in the office. One, I want to be able to assess a tendonitis to determine that it's actually a tendonitis or not a myofascial problem or a ligament injury or even yet maybe a hairline fracture, because all of those structures can send pain signals to my brain and are all coming from a really similar place. So I need to know exactly which one I'm dealing with. But tendons are quite often sort of what they call a sprain strain. You could be walking down the street and you roll your ankle off the edge of a curb and you've got the anterior talofibular ligament that could be injured, or your peroneal tendon. Both of those structures get a lot of load when the foot rolls inward. So I'd like to be able to assess which one that you actually injured. But ligaments and tendons fall into a very neat little category here, where these collagen fibrils and the actual matrix and nature of a tendon itself can be looked at in a microscope, and you would see this matrix of folds and spirals. And the folds are the way the tissue is actually aligned, the way these actual molecular structure of a tendon looks like under a microscope. And it's extremely important to understand this, because this is how your body is going to be healing this thing. So what Per Aspenberg did, very cruel experiments actually. He took rats and he nicked their Achilles tendons. They're a great thing to test because Achilles tendon, as you know, in your own body and especially on a rat, is extremely big and strong, and it's a beautiful structure to test to see how it works. And so if you look here on this graph, there's force against it. And there's distension, or the length of the tendon. So if I'm standing up and I'm doing a calf raise and I'm letting my heel drop back down, I'm lengthening that Achilles tendon. And that's the distension. The force would be my body weight. But if somebody were to come on top of me and push down on me and put more force, more force, more force, you're going to see this graph form. So nice and relaxed down here, low force, no length here at the bottom corner of our graph. And then as I'm putting force on this tissue and I'm putting length on this tissue, we're going to get to a point where all of a sudden, boom, snap. Now we have an injury. Now, very rarely are these things going to what they call avulse or pull away from the bone completely. They're going to be damaged within. And we go back again to what looks like inside. You've got this matrix of spiral-based molecular structure and also folded-based molecular structure. And the two of those things are what's deep down in that tendon that makes it so strong. But you know what? Everything's got a point of breaking. And when it breaks, you can see on this graph here. So what Per Aspenberg did, and I think that you guys would find extremely interesting, is what do we do to fix this? Now, the standard therapy for almost all of these is going to be rest, ice, compression, elevation. And that is correct. The first thing you want to do is rest and not put additional loads on it. You might not know the severity of the injury. You might not know how badly damaged these fibrils are. And so it's best to be sort of cautious about that and be gingerly with it. Maybe perhaps if it is an ankle injury, that you're walking carefully and you're going to notice that your body actually goes into a flat foot gait very quickly. It's not going to want to push off on a structure that's injured. So listen to your body. It's telling you something. That said, do not progress with fear either, because what I'm about to tell you is that you want to use loads to do it, and you're probably not going to want to, because you're going to feel like you're going to damage it further. There is a point of diminishing return, absolutely, but most of these injuries can be healed naturally by putting a very progressive set of loads. And this is exactly what Per Aspenberg did. The beauty of it, it's done on rats, it's done in a lab, and we can rule out all the other variables that humans can't really do. It's very difficult to take your life and put it into a laboratory. If you're an athlete, you're going to be wondering, okay, should I cancel that next event? Should I not go to the gym? Well, we're going to try to answer that question here using the work of Per Aspenberg. A majority, probably 95% of these injuries can self-heal if you're patient and you apply the concepts of this video to your injury. So we've now exceeded the point where the tendon can no longer support the structure. Well, again, we'll use Achilles tendon. This can be any tendon, by the way. This is a lateral epicondylitis, is another form of a tennis injury where the tendon for the extensor muscles in my forearm are being micro-traumaed by hitting backhands or aggressive serves. The two motions that you see quite often cause lateral epicondylitis or tennis elbow. You have a golfer's elbow, just the same. They're all tendons. So how do I make my tendon come back to this? So in the event that you do not have a ruptured Achilles tendon, the work of Per Aspenberg teaches us there's different methodologies in getting this, again, this tendon injury, this tendonitis or tendinopathy treated non-surgically. If you were to take corticosteroid injections, you take anti-inflammatories, if you try PRP, try stem cell therapy. Per Aspenberg tested all of these different theoretical treatment approaches on these Achilles tendons that he nicked on these rats. And the one that came up the winner is mechanical loading. So hence the reason why the injury process would likely to begin much more effectively if you were to try to, let's say, limp for a few days. Again, knowing the severity of the injury is critical here. If the injury is swollen and you can't weight bear on it for more than, let's say, 2 or 3 days, then you need to have an MRI. You need to take a look at the severity of the injury. But in the event that you just have again, most of you do not have that, or a rupture of the Achilles tendon, it's a very difficult structure to rupture. Then you're mostly dealing with a lower grade, a sort of micro trauma of the tendinous tissue itself. And this is where mechanical loading does better than any of the other, number one, more expensive, but also the ones that are going to delay the healing process by virtue of changing the inflammatory cycles, the messages that happen during a normal course of healing for a tendon injury. So again, I hope I help to steer you guys in the right direction of a sort of being prudent, not being overly worried, but not being foolish about the course of care for a tendonitis. The work of Per Aspenberg shows us that we can actually repair these things in a very slow and methodical fashion by slow load bearing. And that's what I'd like most of you guys to try that approach before you run off and have expensive procedures done on these tendinopathies and these tendon injuries. Take care.